Hi, thank you so much for requesting your free knee report on how to end knee pain without needing a referral from a doctor. I'm Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness. I'm a physical therapist, an athletic trainer, and a fitness coach. One of the first things that you can do to get rid of knee pain is to sit in a chair with your feet flat on the floor. When you cross your ankles or cross your knees or cross your legs, you are going to put more stress on the knee joint, and this can create pain or discomfort. The second thing that you can do is purchase the right types of shoes. You want a shoe that is supportive, you want to avoid high heels and pointy shoes, and you want to avoid wooden soles that are hard and don't allow a lot of cushion. The third thing that you can do is avoid high heels. Like I said earlier, when someone wears high heels, they're going to put more stress on their knee joint because they're going to hyperextend their knee because their heels are higher off of the ground. This puts a lot of pressure on the knee joint and can create pain. The fourth thing to try is low impact exercise. Walking on a treadmill is low impact, but you can also do cycling and swimming, which are great low impact exercises that decrease pressure on the knees. You can also try heat or ice. If your knee is stiff and achy, I would go with heat. If it's sharp and shooting, I would go with ice. The sixth thing that you can do is maintain appropriate body weight. When you are overweight or obese, you're putting a lot of pressure and forces on your joints. Just losing 10 pounds actually takes 30 pounds of pressure off of your body. That's because for every pound somebody loses, it's 3 pounds of force off of your body. So if you gain a pound, you're adding 3 pounds of force. But if you lose a pound, you're losing 3 pounds of force. That's why just losing 10 pounds equates to 30 pounds of force lost on your joints and spine. The seventh thing that you can do is stretch. When your muscles are flexible, your muscles don't pull at their joints. And if they're not pulling at their joints, they're not creating forces across the knee joint that can create stress and also create pain. The eighth tip that you can do is go to physical therapy. If you've had knee pain for more than 10 days, I strongly encourage you to seek out a physical therapist because that pain probably isn't going away on its own. All of the tips in this ebook are going to be able to be improved upon when they're complemented with a course of physical therapy. Some bonus tips for you that you can get from a physical therapist are the right stretches for you. Looking on the internet and finding a gamut of stretches may or may not be effective for you, but seeking out a physical therapist who can give you the right exercises for what you are dealing with will be the best medicine. The other tip that you can do is avoid limping. If you're limping, I definitely encourage you to seek out a physical therapist. The reason for this is when you limp, you're putting stresses on your body that aren't meant to be there. And that can make not only your knee hurt more, but it can make the rest of your body sore as well. The third thing that you can do is strengthen your back. Now, what does my back have to do with my knees? Well, if your knees are hurting, they can lead to back pain, but also if you don't have good posture and you don't have good core muscles and good back strength, then your posture can be affected. You can walk differently, you might sit differently, and that can influence your knee. I hope these tips are helpful. If you have questions, please don't hesitate to call me at 262-842-2220 or explore our website even farther at dewittptwellness.com. Thank you so much.